Hello, today we're going to go over bubble CPAP initiation on the neonate at Peace Health Southwest. Before we get started with our patient, let's discuss some of the patient interfaces that we have available with our FMP system. Over here we have 3 size flexi trunks. We have our tackle box that is full of masks, prongs, bonnets, chin strap, and we even have Neo Seals. Our FMP system comes pre-set up in a whole kit with everything we need to set up our circuit and CPAP generator. Our device put together looks like this. We have our inspiratory and expiratory limb with our inspiratory limb attached to our water chamber. On the other port of the water chamber we have our pressure regulator, and then or pressure manifold, then our O2 connector and O2 tubing, which will be hooked up to our flow meter connected to the wall. Down here we have our CPAP generator. Now our CPAP generator needs to be filled with sterile distilled water, and we have a marking line of where to stop. Now don't be too worried about getting it perfect. You can actually fill this all the way up until the water starts overflowing into this chamber, which is an overfill chamber. So you don't even have to measure it, just fill until it starts filling that chamber. Setting our device, we use our plunger, and in order to determine the correct pressure, we will set the number directly above this top plate. So in this case, we can see 5, meaning we're at a CPAP of 5 centimeters of water. All right. Our heater has 2 modalities. We have an invasive and a non-invasive mode. Our invasive is set to 37 degrees Celsius, and that is the mode that we're going to use when initiating bubble CPAP. I know it's not invasive therapy, but baby's temperature needs to be maintained at a 37 degrees Celsius. Last, here at Peace Health Southwest, we utilize a pressure monitor. We use the Snappa LP15 pressure monitor, and this helps us know whether we have a drastic leak or occlusion, and that we can fix if we see it. And we'll get to that in a little bit. So before we actually initiate therapy, we do need to set up our equipment and pick the correct size mask or prong, bonnet, and flexi trunk. So first we're going to start with our bonnet. So we're going to measure the circumference of our baby's head, and in our little tackle box we have the tape measure. And measuring, looks like we're about 29 centimeters. As I mentioned, our bonnets come in multiple sizes, so I picked the 29 to 36 so that way I have room for growth. Once I take it out of the package, I will also give it a stretch. Go ahead and place that on our patient. When we place it, we want to make sure this securement anchor will be lined up with the nose of the baby.
New patients to room 257, coming directly triage. New patients to room 257.
Now this is going to help keep the baby's head warm and also secure our flexi trunk and mask or prongs to the patient's face. We'll tie our end off so the baby's head stays warm. Next, we want to measure the nose and nares. So we have 2 options here in the flexi trunk kit. It's a little measuring tool for our masks and for nair sizes. Now for the mask, we'll just put it over the patient's nose, and we want to look for the size that fits the entire nose in that little clear window. We don't want this opaque area is the cushion of the mask, and we don't want that to sit on the eyes or on the lip. We want it between the septum and the upper lip, and we want it to sit on the bridge of the nose. I feel like we can probably get away with an extra large. This is a large baby. Not quite neonate on this one. Now, as I mentioned, we can also measure for the nares. And the nares, we're gonna try and match up the holes, diameter and the width. And it looks like 50-50 is our size. Now we want to occlude as much of the nares as possible without stretching them out. We also want to make sure that the holes are not too wide so we do not stretch the nose. If our baby lands in between the numbers, we can utilize a NeoSeal to help mitigate that gap that we might have. And we'll go over this in a sec. So now that we've determined the size of the prong or mask, we need to determine the size of our actual flexi trunk. And as I mentioned, we have 3. So we'll start with our smallest one, 50 centimeters. The way we measure it is from the upper lip to the top of the head. And we want to make sure that the clear portion of the trunk, or this opaque portion, does not pass the top of the head. So we can take our little gauge here. We'll rest it right underneath the septum. We'll kind of keep it at the same angle that we want to administer therapy at, and line up our tool here. Now it looks like our tool is crooked, but that's because it's perpendicular to the angle of the head. And our device comes very short of the edge of the head. I think that's too short. Let's try the largest size. Same thing, we're gonna start just underneath the septum, have it angled correctly. And this one, as you can see, goes past the top of the head quite far. So I don't wanna use that either, because then that may leave too much weight on the end. Now the middle size, again, we'll put it right under the septum. We'll put in our marker here, and it looks like we're as close as we're gonna get. We're right on the edge of the trunk. So I think this one will work for our baby. Once we've determined the size, then we can place on our mask or prong. And when we put our mask or prong on, we wanna make sure that they're facing towards the opening of the patient or the bridge of the nose. And we mentioned the NeoSeal. So let's find the correct size. We have a number of different sizes, and I'm gonna go with the middle and trial it. And it looks like that one's a good size. So I will place one NeoSeal with the sticky part towards the interface. Now we can place between 1 and 3 before we need a physician's order. If we need more than 3, we'll want to notify our physician and ask for an order. This also helps us leave a 2 millimeter gap between the septum and our device, which helps prevent skin breakdown. If we're using a mask, we want to integrate a barrier, and we're going to use the Mepilex. And what we're going to do is cut a little piece of our Mepilex into a 1 centimeter by 2 centimeter little rectangle. And then it'll be placed on the edge of the nose, going up and over the bridge. And this will help protect the bridge of the nose when we use a mask. Now that we've picked all the correct sizes that we need, let's hook up our flexi trunk to our bubble CPAP circuit. And then I'm going to glue the end and make sure I have a complete circuit. And I'm listening for bubbles. So that's telling me that my circuit is set up correctly. I've occluded my patient end. My circuit is not open, so I know it's ready to go on the patient. So let's get it on our patient. Now we're going to place our prongs in the patient's nares. And we want to maintain that 2 millimeter gap between the septum and the device. Now we do have that barrier, the NeoSeal, so that's going to help maintain that gap. We also want to make sure that our flexi trunk is lined up parallel with the patient's face. So we don't want it too high or too low, because if it's not sitting correctly, the tips of the prongs or the mask will be angled incorrectly. With the prongs, if they're too high, they will be hitting the top of the patient's, inside of the patient's nose. And if they're angled down, the bottom of the prongs are going to hit the bottom of the inside of the patient's nose, which can lead to skin breakdown. So we'll place it back in. And the flexi trunk does come with these little wedges that we can subtract or add to make sure we get the proper balance. Now if we come down here and look at the angle, with no wedges, I feel like it's too low. So I'm going to put one wedge. Then I'll secure it. And then I will secure the side straps. Now, when we tighten it, we don't want to do it too tight, just enough to hold the device in place. And once we have it in place, we want to verify that we can move our device away from the patient and not create any blanching. We know we have a good seal when we're hearing bubbling. We'll have you come around here. When you're hearing bubbling in our CPAP generator, we also want to auscultate bubbling on inspiration and expiration in the baby's lungs. Now, we don't need vigorous bubbling coming from our device. We don't need to hear it coming outside the room. We just need the minimum inspiratory flow to deliver what the patient needs. And how do we determine that? Well, we initiate flow at 6. It's a safe liter flow for our neonates on initiation. But then we're going to titrate to the patient's inspiratory demand, and while maintaining our ordered CPAP. So let's find out if we are actually giving what we're ordered. So we're going to take our pressure monitor, which I talked about earlier. We'll turn it on. Our first number is just our device number, and then we want to calibrate. We're going to hit this bottom corner digit button, hold it down, let it calibrate. Then we want to initiate monitoring proximal to the patient. Now on the flexi trunk, there's a little port that we could connect our pressure line. So we'll put it in here, twist it on, and we'll see our monitor ramp up. Now I initiated therapy at 6 liters a minute, and I'm only getting 4.8. Now we're delivering a pressure of 4.8. Before I manipulate the flow to meet our required CPAP pressure, I want to make sure our device is leak-free. I'm going to make sure that my flexi trunk is angled correctly. I may have to remove or add a wedge. Make sure that it's not too tight or too loose. And if our baby is unable to keep their mouth closed, we might want to give them a binky or provide them with a chin strap. Now this is an as-needed device. We have a number of different devices. Currently, we're using the Neonates. It has 2 ear holes, so we can don't put pressure on the ears, and then a little hole for the chin. They do come in 3 sizes, so let's measure our baby's head and see what size that we need. Now we're going to measure around the chin and top of the head. It'll go around. And it looks like we're about 31 centimeters. Now, the three sizes have corresponding measurements, so we'll find the best size for that. A small typically fits a 36 to 46, so we're going to go to large, and I believe I already have a large with me. When we put our chin straps, if our baby's already with the bonnet secured, we want to undo the side anchor supports here. We will place our chin strap right on the chin with the left side on the left, and wrap the strap around the top of the head, making sure our ears are in the pockets. And any excess can be fed through there and trimmed if you want. Now, when we secure it with the Velcro, we do not need to tighten it a lot. It does not take a lot of support to hold closed the baby's mouth. So we're going to just lightly maintain a light pressure, almost like resting your finger there. And we'll place our anchors back on. And now we'll re-verify that we are delivering the adequate pressure. So I'm still reading about 4.8. So this baby needs a little more flow. So I can deliver a little more flow. Now, most neonates will only require 4 or 5 liters per minute to maintain a CPAP of 5 centimeters of water. So keep that in mind. We'll discuss flow in a little bit here and what problems that could occur with too much flow. So I think we're pretty close. 4.9. I have my plunger set at 5. I'm reading 4.9. That is a very good number to get, considering we may still have a small leak. It is not a closed system. Now, we do have another place we can actually monitor our pressure. What if we need to do skin-to-skin contact and the position of the line, pressure line, causes problem? So let's place it actually on our pressure manifold. When we place it at the pressure manifold, we're actually going to get a higher reading, about 1 centimeter higher. And that's because this is where our initial delivery happens. We also have higher heat here, which increases the pressure. So this is very normal, and that's okay. It is not the actual pressure being delivered to the baby, because we've already verified that at the baby. Wherever you decide to monitor your pressure, that is where you're going to set your alarms. So when I was at the baby, I was reading 4.9. I will set my high and low, 1 centimeter high, 1 centimeter low from that spot. The monitoring here at the manifold, I'm reading 5.8. So my alarm will be set from this base number. To set it, we're going to hit the plus button down. Our first digit is our low alarm, and we're reading 5.8, so I'm going to go to 4.8, and then we're going to go to high to 6.8, and then hit it again, and we have our alarm volume. Now your alarm volume should be loud enough where you can hear it outside the room, but not too loud where it can overly disturb your baby. I discussed too much flow a second ago. Now, when our baby grows, their lungs should be getting better, and we should be able to reduce the flow, or our babies are just getting healthier, and we should be able to reduce the flow to the minimum required number. But there are times where we may see this number and it is not where we intended, and it is our instinct to increase our flow until we get to the pressure reading that was ordered. When we do this, we run the risk of increasing gastric distension, because I said this is not a closed system. Some of the air may be swallowed by the baby and stay in the stomach. Now, neonates have preterm neonates have a harder time doing gastric emptying. We can help with that by providing the baby with an OG tube to help mitigate the gastric empty. But even with an OG tube, having too much flow can still cause gastric distension. That increase in gastric distension will then put pressure on the gastric contents, which again reduces gastric emptying. That increased pressure in the stomach will also put increased pressure on the diaphragm, not allowing for complete alveolar filling. Again, requiring then more flow to reach our goal pressure. So it is a vicious cycle. So we want to be very careful about increasing the flow when we're not getting our reading that we want. Always check your leaks. Make sure your circuit is clear of fluid. Make sure their nares are clear of mucosa plugs. And make sure our seals are good. Now, I mentioned the baby growing and having to reduce the pressure. As the baby grows, so will our patient interfaces. We want to do cares on our patient at least every 6 hours, and with those cares, we're actually going to remove all the patient interfaces to get a good look at our skin. So let's do that. Now, during this time, ideally your baby should be able to maintain some time off the bubble CPAP. If not, we can always administer Neopuff or just hold it on their nose while we do cares. When we're doing our cares, we want to remove our chin strap. Make sure we have no blanching or breakdown around the chin. We want to remove our bonnet and make sure we have no bruising or blanching on the scalp. We also want to massage our scalp so we could get good blood flow. Now, if we were using a mask and we have our skin barrier here, we also want to remove our skin barrier so we could get a very good look at the nose. When it comes time to put everything back, we want to verify that the size is still good. So we may remeasure our head and the head circumference or the chin circumference to make sure that our bonnet is still good, that our chin strap will still work, whether or not we need to size up on our mask or prongs, because our baby is growing in the first 6 hours, but after a couple of days, we should be thinking about increasing our devices. We should also be thinking about alternating our interface. So I had them on a prong. Now, if the baby tolerates, we can switch them to a mask. If they don't tolerate, then we'll leave them with a prong. And that covers everything we need to know about bubble CPAP initiation in the NICU. If you have additional questions or want more hands-on sim or experience, please find me and we'll go over it one-on-one. Thank you.